Welcome to Breaking Down Mental Health with Dr. Jones. In these educational videos, Dr. Jones will discuss mental health diagnosis, clinical supervision, using technology in counseling, multiculturalism, and many other topics to help you get a healthy understanding of why mental health is important. Please don't forget to like, subscribe, and hit the notification button if you enjoy these videos.
Welcome to the Deep Dive. Today, we're embarking on, well, a really essential exploration, navigating the ever-evolving landscape of telemental health. This isn't just about plugging in new tech, it's about holding on to the core of ethical care, in this virtual world. Our mission here is pretty clear. Let's pull out those crucial insights on clinical boundaries, handling dual relationships, and really nailing professionalism in these virtual therapy spaces. We've got a great set of sources lined up for you. And critically, in today's session, we're exploring key telemental health practices based on the foundational work of Dr. Michael Jones. He's a respected counselor educator and a board-certified telemental health provider.
That's right. And the material we're drawing on today synthesizes the latest research with the ethical standards we all know, like the ACA Code from 2014 and the newer NBCC Code from 2023. This deep dive is really designed to give master's-level mental health counselors like you actionable, practical knowledge, things you can use right away.
Okay, great. And just a quick note for everyone listening. While the audio in this recording is AI generated for accessibility, the instructional design and all the content were authored by Dr. Michael Jones. Right then, so let's dive right into it. The world of therapy, wow, it's seen this huge, rapid expansion into telemental health, TMH, and it's been amazing for access, hasn't it? Reaching clients who maybe couldn't get care before, breaking down barriers. But, and it's a big but, with that transformation comes a whole new set of complexities we really need to get our heads around. Wouldn't you agree?
Oh, absolutely. I mean, think about it. In traditional therapy, face-to-face, we rely so much on subtle cues, right? Body language, the energy in the room. We have the physical office space itself, setting boundaries. You walk in, you sit down, the session happens there. In virtual settings, all of that gets replaced by screens, by digital interfaces, and that immediately throws up some unique challenges, especially around managing communication outside the session, keeping that relational clarity sharp, managing roles properly, all while sticking to those ethical standards from ACA and NBCC. It's a lot.
It really is. Maybe we should pin down some key terms first, just so we're all on the same page.
Good idea. Okay, first, telemental health, TMH. Basically, providing mental health services remotely using tech, video calls, phones, secure messaging, that sort of thing.
Got it. Standard definition.
Exactly. Then, clinical boundaries. These are the professional limits, the rules defining the therapeutic relationship. Think of them as guardrails, for safety, ethics, effectiveness.
Like, they're guardrails. Makes sense.
Then there's dual relationships. This is when a therapist has the professional therapy relationship, but also another kind of relationship with the same client. Maybe they know each other socially or through business. These are tricky because they can really cloud judgment, impair objectivity, even cause harm. Big ethical red flag.
Okay, definitely one to watch out for, especially online, maybe?
Potentially, yeah. And finally, relational clarity. This just means having a really explicit, unambiguous understanding between therapist and client about the nature of the relationship, the roles, the boundaries. Super important online because you lose some of those nonverbal cues we rely on. Assumptions can creep in easily.
That makes perfect sense. And speaking of those digital interfaces, one of the biggest areas these complexities pop up is what we call out-of-session communication, right? Like any chat outside the scheduled slot, texts, emails, maybe messages through a client portal. They're convenient, sure, but they can really blur those temporal boundaries, that clear line between session time and not session time, like getting a text at 9 p.m.
Precisely.
Yeah.
That convenience is a double-edged sword. It brings a risk, often unseen, called alliance degradation. Imagine a client sends an email late at night, maybe feeling vulnerable after a tough session. They're looking for some reassurance, maybe just an acknowledgement. But if that email sits there for, say, 12, 18 hours, even if you have a clear policy, their internal story might become, oh, they don't care, or I'm just bothering them.
Ah, I see. So the trust starts to fray.
Exactly. That therapeutic alliance, that bond can weaken. And according to Dr. Jones's interpretation of the TMHE content outline, this is a significant risk. If expectations around communication aren't crystal clear, or if response delays happen, clients can easily read that as rejection.
Yeah, I can totally see how the informal feel of texting, for instance, could lead to what the sources call boundary erosion, or even nudge towards those dual relationship risks. It just feels less formal, doesn't it? So clients might treat it that way, blurring lines if we're not careful about using professional encrypted platforms.
Exactly. It tricks people, sometimes both the client and the therapist, into relaxing those professional boundaries.
But isn't there also a risk for the therapist, like feeling you have to be on all the time?
Oh, definitely. That perceived need for 247 availability. That leads straight to therapist burnout, feeling constantly tethered to the device, the notifications. It's exhausting.
So how do we manage that? Avoid burnout and the ethical pitfalls. What are the actual best practices here?
Okay, so this is where we get practical. And Dr. Jones emphasizes in his training that these practices are like non-negotiable for ethical practice. First, absolute must. Use HIPAA compliant platforms. All digital communication needs secure, encrypted channels. Protects confidentiality. Foundational stuff.
Right. No personal email or texting for clinical stuff.
Absolutely not. Second, clear communication policies. Get these detailed guidelines right into your informed consent. Spell out acceptable channels, what topics are okay outside sessions and what's not.
Like no crisis support via email.
Precisely. Third, maintain an administrative focus. Keep out-of-session communication strictly for things like scheduling, billing, maybe tech support for the platform. Therapy talk stays in the session.
Okay, keep it logistical.
Yeah. And finally, robust documentation protocols. Document every asynchronous exchange, emails, portal messages, everything. Also, use auto-replies to manage expectations about response times. And review these policies at intake and, regularly throughout treatment.
That documentation piece feels huge. It connects directly to that clarity we were talking about, doesn't it? Because without those records, those quick digital messages could become a real headache later if there's a dispute. It's not just tidy files, it's ethical integrity.
It absolutely is.
Yeah.
Digital care demands clear, consistent documentation. The ACA Code, Section H.4a, and the NBCC's Professional Responsibility Principle both hammer home the need for transparency. If there's ever a question about what was said or promised outside a session and you don't have that email or message documented, you're exposed. Liability, ethical questions. It's crucial.
So we need really solid sample consent language then, spelling out response times, after-hours protocols, which channels are okay.
Exactly. That explicit language and the informed consent is step one. And adding auto-replies is super helpful too. They just acknowledge the message came in and set that expectation. I'll respond within 24 business hours or whatever your policy is. Manages anxiety on the client's end.
That's smart. Simple but effective.
Yeah. And definitely do regular policy reviews. Intake, sure, but also maybe every 6 months. Or if your tech changes, don't just assume they remember signing the form way back when.
Okay, which brings us to another really interesting point. Client perception and relational dynamics. How does this all feel different online, the relationship itself?
Well, it is different. Those dynamics shift because you lose so much nonverbal data, right?
Yeah.
The subtle shifts, the spatial cues. So silence online or a slight delay, it can be interpreted very differently by a client, maybe as withdrawal or disinterest.
I can see that.
We talk about the Digital Therapeutic Alliance, the DTA. It's definitely possible to build strong bonds online. Lots of clients do. But it's often perceived, maybe subconsciously, as a bit weaker or less real than in person. And we also have to remember culture plays a role here. Well, cultural expectations about communication speed and availability vary wildly. Some cultures might expect near-instant responses as a sign of respect. Others might find that intrusive. If we just apply one rigid boundary model without thinking about that, we could actually damage the relationship without meaning to. Need sensitivity.
Wow, okay, so that makes maintaining relational clarity even more vital and maybe more complex in this virtual space. It needs real intention.
It absolutely does. So a few key practices here. First, be ready for intentional repair. Miscommunications will happen digitally. Acknowledge the limits. Tone is hard in email, I realize, and actively fix any ruptures.
Don't just ignore it if something feels off.
Right. Second, frame boundaries as care. This is huge. Explicitly explain that limits aren't rejection. They're about protecting the therapy, keeping it focused and safe for them.
How would you actually say that, though? To make it sound like care, not a rule?
Maybe something like, to make sure our session time is fully focused on you, I have specific times I check messages outside of sessions. This protects our dedicated therapeutic work together. Explaining the why.
Okay, I like that. Explaining the benefit to them.
Exactly. And third, regular check-ins. Keep revisiting expectations about communication. Ask them how it's feeling. Is the policy working for them? It has to be an ongoing dialogue.
Got it. So let's tie this all back to the actual ethical codes. What's the bottom line for our practice, according to the ACA and NBCC?
Well, the codes give us the foundation. The ACA Code from 2014, for example. 8.5D warns against dual relationships that impair objectivity or cause harm, very relevant with informal digital chat. EPN6.AB talks about setting and maintaining boundaries, especially if roles shift. Think about having a client's number for scheduling versus therapeutic chat. Big difference.
Right.
And H2LRA specifically mandates clearly communicating the nature and limits of telemental health services. Transparency, again.
And the NBCC.
Similar principles. Their 2023 code, particularly Principle 3, Professional Responsibility, directly addresses the need for clear communication, role clarity, and integrity within virtual contexts. These aren't just dusty rule books. They're active guides for ethical practice right now in this digital space.
Okay, so it really boils down to concrete best practices for virtual professionalism.
Right.
What are those key steps counselors need to take?
Right. And Dr. Jones's work really underscores these as crucial for navigating virtual spaces with integrity. First, regular ethics training. Keep learning. The digital world changes fast, so stay updated on digital ethics through CEUs, workshops, whatever.
Continuous learning. Makes sense.
Second, have a solid risk management plan, specifically for digital practice. Think about boundary issues, tech failures, security breaches. Plan for them.
Don't wait for a crisis.
Exactly. Third, use professional consultation. Don't go it alone with tricky ethical dilemmas online. Talk to supervisors, peers, legal counsel if needed. Get support.
Good advice.
And finally, policy documentation. Keep meticulous records of your communication policies and proof that clients acknowledge them. That paper trail or digital trail is your safeguard.
Wow. Okay, that was a really thorough deep dive. It's so clear that being professional online isn't just about, using Zoom instead of an office. It demands really proactive boundaries, super clear documented policies, and this relational clarity that's specifically tuned into the digital world. You have to be so intentional.
Absolutely. And when clinicians anchor their practice in those ethical codes, integrate the research, they can navigate virtual spaces with real integrity. It protects clients, prevents burnout, and ultimately it sustains the effectiveness of the therapy itself. It's about building a sustainable, ethical practice for this era.
That's a really positive way to frame it. And it leaves me with a final thought, something for you listening to consider. How might adapting these really rigorous, intentional boundary practices in a virtual setting actually enhance the depth of the therapy relationship rather than diminish it? Could this level of transparency and intentional communication actually build stronger trust? Something to think about. This training segment was developed by Dr. Michael Jones and aligns with best practices in telemental health as outlined in the TMHE, ACA, NBCC, and CACREP standards. Thanks so much for joining us on the Deep Dive.